Knee and hip osteoarthritis. Osteoarthritis is very common in the hips and the knees because they're weight-bearing joints. So during life, we're running around doing activities, and the majority, all of our weight really goes through our hips and our knees. And it's magnified if we're slightly overweight because the levers involved, the length of the hips, the length of the knees, the weight that goes through these joints can be magnified as a result of the mechanics involved. What arthritis actually means is arth meaning joint, itis meaning inflammation, and it's an inflammation or degeneration over time of the joint surfaces. So you may have seen some x-rays where the joint space is being assessed, so we're looking to see how much space is left between the two bony surfaces. And an x-ray can identify this pretty well on a hip and on a knee, which can give you a good indication radiologically how advanced the arthritis might be. Now, an important point to make here is that the radiological imaging showing arthritis relates very poorly to how people feel symptomatically. So it's quite common to see a knee or a hip x-ray which looks perfect and the person's got significant pain, or vice versa, a knee or hip x-ray where the joints look really quite arthritic to the point where you may consider a replacement, really quite severe, and yet the person is pain-free, no problems at all. So when making a clinical diagnosis of osteoarthritis, we really need to take into account any image findings, for example x-ray, with the clinical symptoms. And unless the clinical symptoms indicate this person needs ongoing or further treatment, we really wouldn't be recommending anything from a surgical or injection perspective. We're looking at the symptoms the person presents with, how they're able to function, and from there we can determine what we should be doing. One thing we do know with certainty is when it comes to hip, knee or general arthritis, improving the strength and mobility to the absolute best that that person can manage is important. There's some great resources on the website showing exercises from a very early stage, in terms of very early stage of rehabilitation, through to quite advanced work, which is definitely worth doing. So even if you're looking at having a hip or knee replacement, improving the strength pre-operation will help greatly post-operation for your recovery. If you look at the patient resource section, there's some good information about basic strengthening and progressing through to quite advanced work.